Question 1. In the context of ultrasound-guided procedures, what is the primary role of high-frequency transducers in breast imaging? A. To provide high-resolution images for visualizing small details of superficial lesions. B. To penetrate deeper into the breast tissue to assess larger masses. C. To eliminate the need for Doppler imaging in detecting blood flow. D. To enhance the evaluation of the lymphatic system and its involvement in breast cancer staging. Answer. Correct answer A. Explanation. High-frequency transducers are used primarily in breast ultrasound to provide high-resolution imaging, making them ideal for visualizing superficial lesions, which is crucial for detecting small masses or cysts. The high-frequency nature results in a superior image quality for structures close to the skin surface. On the other hand, deeper lesions require low-frequency transducers for better penetration. Imaging and lymphatic assessments are separate functions that do not rely on high-frequency transducers alone. Question 2. Which of the following is an essential factor when distinguishing benign from malignant breast lesions using ultrasound? A. The lesion's shape, margin, and vascularity. B. The patient's age and menstrual cycle phase. C. The presence of skin changes and nipple discharge. D. The size of the lesion and its proximity to the chest wall. Answer. Correct answer A. Explanation. When evaluating breast lesions with ultrasound, the shape, whether the lesion is round or irregular, margin, smooth or spiculated, and vascularity, whether there is increased blood flow around the lesion, are crucial factors in distinguishing benign from malignant masses. And malignant lesions tend to have irregular shapes, poorly defined margins, and increased vascularity, while benign lesions are typically round or oval with borders and little vascularity. Other factors such as patient age and skin changes may be associated with malignancy but are not as definitive as these ultrasound characteristics. Question 3. What factors contribute to the difficulty in imaging dense breast tissue during a breast ultrasound examination? A. Higher amounts of fibrous tissue and lower amounts of adipose tissue. B. Poor acoustic impedance between glandular and fatty tissues. C. Increased vascularization leading to significant blood flow interference. D. A higher concentration of lymph nodes obstructing the view. Answer. Correct answer A. Explanation. Dense breast tissue, which contains a higher proportion of glandular and fibrous tissue relative to adipose tissue, poses a challenge for ultrasound imaging. These tissue types have different acoustic properties, which can interfere with sound wave transmission, leading to reduced image quality. In contrast, fatty tissue allows sound waves to pass more easily, providing clearer images. The presence of vascularization or lymph does not significantly affect the imaging of dense tissue, though they may impact tumor evaluation. Question 4. Given the circumstances where a 50-year-old female patient with a family history of breast cancer undergoes a follow-up ultrasound after mammography, which of the following findings would be most concerning for malignancy? A. A well-circumscribed, solid lesion in the upper outer quadrant. B. A hypoechoic lesion with irregular, spiculated margins and increased vascularity. C. A simple cyst with posterior acoustic enhancement. D. A round anechoic mass with smooth borders and no internal echoes. Answer. Correct answer B. Explanation. A hypoechoic lesion with irregular, spiculated margins and increased vascularity is highly concerning for malignancy. These features are often indicative of invasive breast cancer, particularly in patients with a family history of the disease, while circumscribed lesions A are more likely to be benign, such as fibroadenomas. Simple cysts C and round anechoic masses D also have benign characteristics, typically not associated with malignancy. Question 5. Which of the following is a key benefit of using contrast-enhanced ultrasound (CEUs) in breast imaging? A. It allows for real-time assessment of lymph node involvement in breast cancer. B. It provides improved delineation of cystic versus solid lesions. C. It enhances the visualization of blood flow and vascular patterns in tumors. D. It eliminates the need for mammography in detecting early-stage cancers. Answer. Correct answer C. Explanation. Contrast-enhanced ultrasound CEUs is particularly valuable in assessing blood flow and vascular patterns within tumors. This is especially important in distinguishing malignant tumors, which tend to have abnormal and increased vascularity from benign lesions. Whilst use can provide additional information, it does not replace mammography in detecting early-stage cancer, and it is not primarily used for distinguishing cystic solid lesions, which can be assessed with standard ultrasound techniques. Question 6. To ensure optimal imaging during a breast ultrasound examination, which of the following factors must be taken into account? A. The patient's position relative to the imaging equipment. B. The resolution settings of the mammography system. C. The amount of radiation exposure during the scan. D. The ultrasound probe's frequency and resolution. Answer. Correct answer. D. Explanation. The frequency and resolution of the ultrasound probe are critical factors in ensuring optimal imaging. Higher frequency probes provide better resolution for superficial structures but have limited penetration, whereas lower frequency probes are more suitable for deeper lesions. The patient's position and comfort are important, but the probe settings play the most significant role in obtaining clear, accurate images. Mammography, ultrasound does not involve radiation exposure. Question 7. From a clinical standpoint, how might one explain the significance of using standard scanning views, such as radial and antiradial, in breast ultrasound? A. To allow visualization of the breast tissue in the coronal plane for better depth assessment. B. To obtain consistent imaging of the same area for follow-up assessments. C. To detect the presence of axillary lymph node involvement. D. To distinguish between benign and malignant lesions based on shape. Answer. Correct answer. B. Explanation. Standard scanning views, such as radial and antiradial, are important in providing reproducible and consistent images, which is crucial for follow-up assessments of breast lesions. By using consistent views, radiologists can compare previous and current images to monitor changes in lesion size, shape, and characteristics. These views are not specifically designed for lymph node assessment or distinguishing benign and malignant lesions, though they may aid in the broader examination. Question 8. Considering the impact of hormonal influences on the breast, how might breast tissue appear on ultrasound during different phases of the menstrual cycle? A. The tissue appears denser and more fibrous during the luteal phase. B. The breast tissue becomes predominantly fatty during ovulation. C. There is an increase in vascularity during the follicular phase. D. The appearance of breast tissue is unaffected by hormonal fluctuations. Answer. Correct answer. A. Explanation. During the luteal phase of the menstrual cycle, breast tissue becomes denser and more fibrous due to hormonal changes, which can make it harder to differentiate between benign and malignant lesions. These changes are primarily caused by progesterone, which promotes glandular proliferation. In contrast, the breast tissue is typically less dense and more fatty during the follicular phase, making ultrasound imaging easier. Increased vascularity (C) may occur, but it is not exclusive to any particular phase. Question 9. To what extent does the use of Doppler ultrasound improve the evaluation of a breast mass suspected to be malignant? A. It allows for the visualization of the tumor's internal structure. B. It helps assess the presence and characteristics of blood flow to the mass. C. It distinguishes between benign and malignant masses based solely on shape. D. It increases the resolution of ultrasound images of the lesion. Answer. Correct answer. B. Explanation. Doppler ultrasound is useful in assessing blood flow to a breast mass. Malignant tumors often exhibit increased and abnormal blood flow patterns due to angiogenesis, formation of new blood vessels. This feature helps differentiate malignant masses from benign ones, which typically have less or no blood flow. Doppler ultrasound does not provide information on the internal structure of the tumor or solely determine benign or malignant nature based on shape (C), and it does not impact image resolution (D). Question 10. Which of the following best describes the role of lymphatic evaluation in breast cancer staging using ultrasound? A. It helps identify distant metastases in organs outside the breast. B. It assesses the involvement of axillary lymph nodes for local staging. C. It is primarily used to identify the tumor's size and location within the breast. D. It determines the tumor's response to neoadjuvant chemotherapy. Answer. Correct answer B. Explanation. Lymphatic evaluation using ultrasound, especially in the axillary region, is crucial for staging breast cancer. The presence of malignant cells in axillary lymph nodes indicates regional spread and plays a significant role in determining the stage of breast cancer. Ultrasound can detect enlarged or abnormal lymph nodes, which may require biopsy for confirmation. Ultrasound is not used to assess distant metastases, A, tumor size and location, C, or treatment response, D. Question 11. In light of recent developments in breast imaging, a sonographer is evaluating a suspicious mass in a patient with extremely dense breast tissue. The lesion is hypoechoic with angular margins and posterior acoustic shadowing. Given that mammography often has reduced sensitivity in dense breasts, which ultrasound-based strategy is most appropriate to increase diagnostic confidence and potentially reduce the need for MRI? A. Employing elastography to assess tissue stiffness. B. Increasing gain and depth to enhance lesion visualization. C. Using panoramic imaging to capture entire breast anatomy. D. Applying Doppler imaging to assess surrounding lymphatic flow. Answer. Correct answer A. Employing elastography to assess tissue stiffness. Explanation. In dense breasts, mammography may miss lesions due to overlapping fibroglandular tissue. High-resolution ultrasound plays a crucial role, and elastography provides added value by differentiating between benign, softer, and malignant, stiffer tissues, increasing specificity. The American College of Radiology ACA Breast Imaging Reporting and Data System BioAds Atlas AM practice parameters recommend adjunctive elastographic assessment in ambiguous cases, particularly in dense breast tissue, before proceeding to MRI. Options B and C enhance image capture but don't directly aid in malignancy risk assessment. Option D misrepresents lymphatic flow. Doppler assesses vascularity, not lymphatics. Question 12. From the perspective of sonographic artifact management, which of the following actions is most effective when encountering posterior acoustic enhancement that obscures lesion margins in a simple cyst? A. Decreasing the overall gain settings. B. Switching to a low-frequency transducer. C. Applying compound imaging or spatial compounding. D. Rotating the transducer perpendicular to the posterior wall. Answer. Correct answer C. Applying compound imaging or spatial compounding. Explanation. Spatial compounding reduces artifacts like posterior enhancement by combining images from different angles, helping define lesion margins. According to AM guidelines and ACA recommendations, it is especially useful in characterizing cysts or solid lesions obscured by acoustic artifacts. Low-frequency transducers B. may decrease resolution. Gain A. can underrepresent lesion characteristics. Perpendicular rotation D. might help alignment but not artifact suppression. Question 13. Taking into account a clinical scenario where a patient with a history of treated breast cancer presents with axillary swelling, ultrasound reveals an oval, hypoechoic lymph node with cortical thickening 3 mm and loss of fatty hilum. What is the most appropriate course of action? A. Schedule a repeat scan in 6 months to observe changes. B. Proceed with ultrasound-guided fine needle aspiration or core biopsy. C. Diagnose as benign due to oval shape and lack of calcification. D. Refer the patient for thermographic imaging as a secondary test. Answer. Correct answer B. Proceed with ultrasound-guided fine needle aspiration or core biopsy. Explanation. The loss of fatty hilum, cortical thickening, and even shape in isolation are concerning signs for metastatic involvement. According to BioAds, suspicious axillary nodes must be sampled. Delaying biopsy A is inappropriate given oncologic history. Shape alone, C, isn't reliable determinant. Thermography D is not valid diagnostic tool per FDA and AM standards. Question 14. While examining breast tissue using Doppler ultrasound, a sonographer notes that a lesion exhibits central vascularity with irregular branching vessels. Which of the following is the most appropriate interpretation? A. Likely benign lesion due to internal vascularity. B. Possible ductal carcinoma due to abnormal central vascularity. C. Normal ductal hyperplasia due to patient's age. D. Artifact caused by improper Doppler angle and should be ignored. Answer. Correct answer B. Possible ductal carcinoma due to abnormal central vascularity. Explanation. Malignant tumors like ductal carcinoma often show central vascularity with chaotic vessel patterns. Struan AM guidelines emphasize using Doppler to evaluate suspicious vascular patterns. Option A is incorrect because benign lesions typically show peripheral or no vascularity. Option C lacks imaging correlation. Option D is dismissive of clinically relevant findings. Question 15. Considering the evidence of 47-year-old patient presence with nipple discharge and irretroareolar masses observed on ultrasound, it is complex with internal echoes, septations, and mild vascularity, which diagnosis should be highest on the differential A fibroadenoma, B galactosal, C intraductal papilloma, D fat necrosis. Answer. Correct answer C intraductal papilloma. Explanation. Intraductal papillomas often present as retroareolar complex masses with discharge and may contain internal vascularity, particularly if symptomatic. Per the BIRADS and NCCN guidelines, these should be biopsied to exclude associated carcinoma. Galactosals B are more common in lactating women and avascular. Fibroadenomas A are rarely retroareolar and overhomogeneous. Fat necrosis D is usually post-trauma. Question 16. The central argument for high-frequency transducers in breast ultrasound lies in A. Deeper penetration required for larger breasts, B. The ability to measure vascular flow using color Doppler, C. Improved near-field resolution critical for superficial lesions, D. Reduction of imaging artifacts in dense tissue. Answer. Correct answer C. Improved near-field resolution critical for superficial lesions. Explanation. Breast ultrasound primarily benefits from high-frequency linear array transducers 1018 MHz due to their superior spatial resolution, especially near-field structures, e.g. superficial nodules. The AM and ECA emphasize their utility for lesion characterization. Option A is incorrect. High frequency reduces penetration. Option B is not frequency dependent. Artifact reduction D is aided more by software, e.g. compounding, than frequency. Question 17. Throughout the course of a breast biopsy, the sonographer notes that the biopsy needle is visible only intermittently. Which of the following adjustments is most effective to ensure continuous visualization? A. Increase the dynamic range. B. Apply tissue harmonic imaging. C. Adjust the needle angle to be more parallel to the transducer. D. Switch to a sector array transducer. Answer. Correct answer C. Adjust the needle angle to be more parallel to the transducer. Explanation. Needle visibility during procedures depends on incident angle relative to the sound beam. Making the needle parallel improves beam reflection. This principle is emphasized in AM ultrasound guided interventional guidelines. Harmonic imaging B and dynamic range A affect contrast, not visibility. Sector transducers D are not ideal. Superficial structures. Question 18. To better understand the impact of menstrual cycle on breast imaging, which of the following is the most appropriate recommendation when scheduling a diagnostic ultrasound? A. Schedule during the late luteal phase for enhanced ductal visibility. B. Schedule post-menstruation when tissue edema is minimal. C. Imaging can be performed anytime as hormone levels don't affect ultrasound. D. Schedule during ovulation due to increased glandular activity. Answer. Correct answer B. Schedule post-menstruation when tissue edema is minimal. Explanation. Hormonal influence on breast tissue peaks in the luteal phase, causing increased glandular echogenicity and edema, which may obscure findings. Therefore, per ACA and ARDMS recommendations, the optimal imaging window is day 710 of the cycle when the breast is least hormonally influenced. Option A, C, and D do not reflect physiologic imaging optimization. Question 19. Upon closer examination, a mass is seen extending into Cooper's ligaments with tethering of adjacent tissues and architectural distortion. Which of the following features most strongly supports malignant etiology? A. Smooth, well-circumscribed margins. B. Hyperechoic internal texture. C. Spiculated margins with posterior shadowing. D. Oval shape oriented parallel to skin. Answer. Correct answer C. Spiculated margins with posterior shadowing. Explanation: spiculated margins and posterior acoustic shadowing are highly predictive of malignancy per BIRADS and SBI Society of Breast Imaging. Cooper's ligament involvement is consistent with invasive disease. Hyperechoic texture B is more typical of benign lesions. Oval shape D and circumscribed margins A are benign descriptors. Question 20. With the advent of 3D breast ultrasound, which of the following is the primary benefit in a diagnostic setting? A. Reduction in acoustic shadowing artifacts. B. Enhanced evaluation of ductal architecture and lesion volume. C. Increased penetration for dense breast parenchyma. D. Superior Doppler sensitivity for microvascular imaging. Answer. Correct answer B. Enhanced evaluation of ductal architecture and lesion volume. Explanation: 3D ultrasound allows multiplanar reconstruction, particularly useful for visualizing ductal systems and calculating lesion volumes, aiding surgical planning. According to M and European Society of Breast Imaging, it enhances reproducibility and documentation. Shadowing A is not significantly impacted. Penetration C is enhanced by 3D tech. Doppler sensitivity D is a separate function. Question 21. A 38-year-old female with a family history of breast cancer presents for a screening ultrasound. The mass identified is hyperechoic with indistinct margins and shows mild posterior acoustic enhancement. Based on these findings, which of the following is the most appropriate next step? A. Proceed with a mammogram to further evaluate the lesion. B. Recommend biopsy for histological evaluation. C. Schedule a follow-up ultrasound in 6 months for monitoring. D. Refer for MRI to the suspicious appearance. Answer. Correct answer A. Proceed with a mammogram to further evaluate the lesion. Explanation: in a patient with a family history of breast cancer, a mammogram is the best follow-up to evaluate hypoechoic lesions with indistinct margins which are concerning for malignancy. According to ACA BIRADS and AM guidelines, a mammogram helps assess lesion characteristics, density, calcifications. Option B is premature. A biopsy is considered after imaging confirmation. Option C could lead to delayed diagnosis. MRI D is not the first line for initial assessment. Question 22. While examining a complex mass in a 45-year-old female, the ultrasound reveals a lesion with cystic areas, smooth walls, and no internal echoes. Which of the following is the most likely diagnosis? A. Fibroadenoma. B. Simple cyst. C. Intraductal carcinoma. D. Hematoma. Answer. Correct answer B. Simple cyst. Explanation: a simple cyst is typically characterized by anechoic, no echoes appearance with smooth walls and posterior acoustic enhancement. This is consistent with a benign diagnosis. Fibroadenomas A solid mass is not cystic. Intraductal carcinoma C is more solid and would present with irregular margins. Hematomas D are generally complex, but they show heterogeneous internal echoes and may have a history of trauma. Question 23. A 60-year-old female with a history of breast cancer presents with the palpable mass in her left breast. Ultrasound reveals a hyperechoic lesion with irregular borders, posterior shadowing, and no cystic components. What is the most likely diagnosis? A. Fibroadenoma. B. Malignant tumor, possibly invasive ductal carcinoma. C. Abscess. D. Fat necrosis. Answer. Correct answer B. Malignant tumor, possibly invasive ductal carcinoma. Explanation: a hypoechoic mass with irregular borders and posterior shadowing is highly suspicious for malignancy, most likely invasive ductal carcinoma, which is the most common type of breast cancer. According to BIRADS and ACA guidelines, often presents as a solid hypoechoic mass. Fibroadenomas are typically well circumscribed and more echogenic. Abscesses C often show internal fluid collections with increased blood flow on Doppler. Fat necrosis D presents with a complex appearance, but this case lacks trauma history. Question 24. During the evaluation of a breast mass, you observe significant shadowing with the lesion displaying a heterogeneous echo texture. The mass appears to be invading the surrounding tissue. Based on these findings, what is the most likely diagnosis? A. Fibroadenoma. B. Benign cyst. C. Malignant lesion, possibly invasive lobular carcinoma. D. Intraductal papilloma. Answer. Correct answer C. Malignant lesion, possibly invasive lobular carcinoma. Explanation. A heterogeneous echo texture with shadowing and tissue invasion strongly suggests a malignant lesion. Invasive lobular carcinoma ilk often has an indistinct margin, causing architectural distortion, which fits the description. Fibroadenoma are well-defined and homogeneous. Benign cysts B are typically smooth and anechoic. Intraductal papillomas D present with central vascularity and may show ductal involvement, but they don't have shadowing or invasion. Question 25. A 28-year-old female with a family history of breast cancer presents with a painless, palpable breast lump. The ultrasound reveals a solid, well-circumscribed mass that is hypoechoic. The lesion shows mild posterior acoustic enhancement but no vascularity. What is the most appropriate next step in management? A. Perform a fine needle aspiration biopsy. B. Recommend a follow-up ultrasound in 6 months. C. Proceed with mammography for further evaluation. D. Refer for MRI to assess the lesion in detail. Answer. Correct answer B. Recommend a follow-up ultrasound in 6 months. Explanation. A solid, well-circumscribed mass with mild posterior enhancement and no vascularity is more likely to be benign, such as a fibroadenoma. Given the patient's age and lack of concerning features, 6-month follow-up is recommended to ensure no changes. Fine needle aspiration is not necessary for a likely benign lesion. Mammography C is not performed on younger patients unless there are high-risk factors. MRI D is reserved for complex or high-risk cases. Question 26. A 55-year-old female undergoing a routine screening mammogram has a suspected mass identified on imaging. Ultrasound confirms a well-defined oval hypoechoic lesion with posterior acoustic enhancement. The lesion does not show signs of calcification. What is the most likely diagnosis? A. Cyst. B. Fibroadenoma. C. Malignant tumor, possibly invasive ductal carcinoma. D. Intraductal papilloma. Answer. Correct answer B. Fibroadenoma. Explanation. A fibroadenoma is typically well-defined oval and hypoechoic with posterior acoustic enhancement. These are the most common benign tumors in the breast and are often found in younger women, but they can also occur in older women. Cysts, they are anechoic and would not typically have enhancement. Invasive ductal carcinoma C would show irregular margins and potentially posterior shadowing. Intraductal papillomas D are usually associated with ductal involvement and nipple discharge, not the appearance described here. Question 27. A 40-year-old female with a family history of breast cancer presents with a small, palpable lesion in her right breast. Ultrasound reveals a small hypoechoic mass with spiculated margins and posterior acoustic shadowing. What is the most appropriate next step? A. Recommend a follow-up ultrasound in 3 months to monitor the lesion. B. Schedule an MRI for further evaluation. C. Perform a fine needle aspiration (FNA) to obtain a tissue sample. D. Perform a core needle biopsy (CNB) for histological diagnosis. Answer. Correct answer D. Perform a core needle biopsy (CNB) for histological diagnosis. Explanation. The spiculated mass with posterior acoustic shadowing is highly suggestive of malignancy, particularly invasive ductal carcinoma. According to Acker-Byrads, a core needle biopsy (CNB) is the most appropriate next step to obtain tissue for histological analysis. FNA-C can also be used, but CNB is preferred for better tissue sampling, especially for spiculated masses. MRI-B is an adjunct tool, but not the first line for diagnosis. Follow-up A is inappropriate when malignancy is suspected. Question 20. During an ultrasound examination, a hypoechoic lesion with irregular margins is found, and it shows an increase in vascularity on Doppler imaging. Based on these findings, which of the following diagnoses is most likely? A. Simple cyst. B. Malignant lesion, possibly invasive ductal carcinoma. C. Fibroadenoma. D. Abscess. Answer. Correct answer B. Malignant lesion, possibly invasive ductal carcinoma. Explanation. A hypoechoic lesion with irregular margins and increased vascularity on Doppler is highly suspicious for malignancy, most commonly invasive ductal carcinoma (ICE). According to ARDMS, malignant lesions often exhibit these features. Fibroadenomas (C) are typically well circumscribed and less vascular. Abscesses (D) show complex internal structure, often with fluid-filled areas, while simple cysts (A) are anechoic with smooth walls and no internal blood flow. Question 29. A 45-year-old woman with a family history of breast cancer presents with a palpable mass. The ultrasound shows a solid mass with circumscribed borders and no internal blood flow. What is the most appropriate next step? A. Recommend a follow-up ultrasound in 6 months. B. Perform a core needle biopsy. C. Schedule a mammogram to further evaluate the mass. D. Refer the patient for a answer. Correct answer C. Schedule a mammogram to further evaluate the mass. Explanation. A solid mass with circumscribed borders and no blood flow is likely benign, such as a fibroadenoma. However, given the family history of breast cancer, a mammogram is the appropriate next step for further evaluation. Core needle biopsy B is premature in this case, as there is no clear indication of malignancy. Follow-up A is generally recommended. Benign appearing masses, but mammography is the standard protocol for any new solid mass in a patient with a family history. Question 30. A 50-year-old woman with a palpable breast mass has an ultrasound showing a complex mass with cystic areas and internal echogenic foci. What is the most appropriate diagnosis? A. Simple cyst. B. Fibroadenoma. C. Intraductal carcinoma. D. Complex cyst with possible benign components. Answer. Correct answer D. Complex cyst with possible benign components. Explanation. A complex cyst with internal echogenic foci is most commonly benign, but requires further investigation to rule out malignancy. The presence of internal echoes may indicate fibrous tissue, blood, or benign papillomas, which are common in complex cysts. According to ARDMS and AM guidelines, further evaluations such as biopsy may be needed if malignancy is suspected. Simple cysts A are typically anechoic with smooth borders, and fibroadenomas B are solid and well circumscribed. Intraductal carcinoma C is unlikely in a cystic mass.